Hey everyone, this is Dr. Luke Peterson, physical therapist with the Knee Replacement Therapist. You're watching the Need to Know show. For this episode, we're going to talk about metabolic health and the relation to joint pain and inflammation. So, when it comes to what causes joint pain, what causes knee pain, what causes arthritis, I like to break it down into you have the mechanical causes. So that's the stress that goes through your joint. So if you're someone who is a very does a lot of running, very intense, lots of training, marathon training, ultra marathon training, or if you have a job that's very labor intensive and puts a lot of stress on your knee joints, very physically demanding, that's kind of some examples of that mechanical end of the spectrum, that mechanical category. And of course, there's a lot of other things that fall within that category. The other category, when it comes to causes of joint pain and reasons for joint pain, is the biological, you can call it the biochemical, systemic type of things going on in your body. So your biology, hormones, chemical signaling, your biology and systemic system, so to speak. So when you talk about arthritis and you talk about joint pain, you talk about knee pain, it's just not only that biomechanical reason. It's not just that wear and tear. It's just not that how much stress and how much pressure and forces that you're putting through your knee joint each day or over time. And one way to think about this is if you look at, for example, running and the relation to knee pain. So what the studies find and what the research finds is people who have the most joint pain, the most knee pain, are both the people who are on the far end of spectrum of lots and lots and lots of training, so super high levels of training, super high frequency, super high volume. We're talking about people training for marathons and ultra marathons and triathlons, Ironmans, all these things. And then there's also significant increased knee pain and joint pain in the people who are on the other end of the spectrum who are completely sedentary. And the people who have kind of the lowest risk are these ones that meet right in the middle. So obviously someone who is completely sedentary isn't putting that much stress through their knee joints and through their joints. They're not putting as much wear and tear, quote unquote, and stress and pressures and forces through their knees and through their joints. But still they have a higher chance of getting this arthritis, getting knee pain, and having knee replacement surgery. And so there has to be another reason for this besides just the mechanical factors, the biomechanical forces and stresses through the joints. And where that is that other category of those systemic things that are happening in your body, the biological, the chemical, biochemistry, things of that nature. So where it comes into play is when we talk about your metabolic health. So when we talk about metabolic health, things you can think of is your weight, your body composition. You can think of your blood pressure, your pulse. You think of your lipid profile, so your cholesterol, triglycerides, LDLs, HDLs, having those in good numbers. If you have atherosclerosis, so the thickening and hardening of the arteries. Do you have diabetes or are you pre-diabetic? Is your blood pressure high? What are your sugars like? What is your glucose like? This is a lot of stuff we're talking about. Do you have a lot of abdominal fat compared to more dispersed fat? Abdominal fat is really a bad thing when it comes to your metabolic health and something you want to avoid for a variety of reasons. But these are kind of all these different things and different factors that we talk about with your metabolic health. And what there is showing is more and more that your metabolic health is going to play a role in your risk and how likely you are to develop arthritis, osteoarthritis, how likely are you to have inflammation either through your body systemically or in your joints. And it's showing that these things are going to have this direct relationship. And what that shows is arthritis development, joint pain, knee pain is really a chemical process, a biological process, just as much as it's a physical mechanical process. And so when we talk about people needing to maintain a healthy weight and maintaining just a healthy metabolic profile in general, so maintaining good cholesterol, maintaining good lipid profile, limiting, good body composition, things like that. It's not because of the mechanical stresses through your joint. It's because these things, lipids, high levels of glucose, high cholesterol, high triglycerides, are going to trigger these things that are going to happen in your body biologically and chemically, and that's going to increase your joint pain, increase inflammation. So what we can do with this and take with this information is basically, be healthy. Do everything you can to be healthy, and that's being physically active and exercising. But the other thing, of course, is managing stress, getting plenty of sleep, and of course, having a healthy diet. And, that might, don't have to get too fancy with it. It's eating fruits and vegetables, eating lean meats and proteins, focusing on complex carbohydrates instead of those simple carbs and sugars and corn syrup and things like that. High fructose corn syrup, don't avoid those things. And if that means for you a Mediterranean diet, if that means trying keto diet, whatever it may be, but it's something that you need to be cognizant of and be aware of for your overall health. And being aware of those things and managing those things is going to help you in the long run. If you're someone who just has knee pain and joint pain, or if you're someone who's already had a knee replacement, the same processes that happened before your knee replacement are still happening after your knee replacement. So you have to be able to manage those to really get the most longevity out of your knees, the most benefit, and the ability to be pain-free and do the activities that you enjoy and like. All right, so this has been the Need to Know Show. We were talking about metabolic health and its relation to joint pain and knee pain, and what are some ways that you can think about this and manage it effectively. And I appreciate you all for watching, and be sure to catch our next video tomorrow. Take care, everyone.